Ever wondered why we get a stuffy nose or sinus problems? Well, it all starts with understanding the anatomy of the nasal cavity and sinuses. The nasal cavity, located right above the mouth, serves as the main gateway for air into our bodies. It's divided into two halves by a thin wall called the septum. The walls of the nasal cavity are lined with a moist, thin layer of tissue known as the mucosa. Now let's delve a little deeper. The nasal cavity also houses the olfactory epithelium, a special tissue responsible for our sense of smell. This powerful tool not only allows us to enjoy life's fragrant pleasures, but also warns us of potential dangers, such as smoke or spoiled food. Besides the nasal cavity, we have the sinuses, air-filled spaces located within the bones surrounding the nasal cavity. These sinuses produce mucus that moisturizes the nose and protects against dust, allergens, and pollutants. However, like any other part of the body, the nasal cavity and sinuses can also face problems. Common issues include sinusitis, nasal congestion, allergic rhinitis, nasal polyps, and a deviated septum. Each of these conditions presents its own set of unique symptoms, causes, and impacts on the quality of life. For example, sinusitis is an inflammation of these sinuses that can cause pain, swelling, and a stuffy nose. On the other hand, a deviated septum, which is a displacement of the wall between the nostrils, can cause difficulty breathing. Fortunately, there are several treatment options available. Medical management, including decongestants, antihistamines, nasal corticosteroids, and saline irrigation, can help alleviate symptoms. For those suffering from allergic rhinitis, allergy testing and immunotherapy can be beneficial. In more severe or refractory cases, surgical options such as endoscopic sinus surgery for chronic sinusitis or nasal polypectomy for large polyps may be considered. These procedures involve endoscopic visualization, tissue removal, and postoperative care. But remember, the choice of treatment should always be individualized, tailored to each person's specific condition and preferences. That's why it's important to maintain regular follow-up with healthcare providers. To wrap it up, maintaining nasal and sinus health is not just about treatment, it's also about prevention. Simple practices such as environmental modifications and good hygiene can go a long way in keeping your nasal cavity and sinuses healthy. So, the next time you find yourself dealing with a stuffy nose or a sinus problem, remember that understanding the underlying anatomy and functions can help you better manage the situation.